Welcome to the edition of News 9 Live. Today, in this special edition, I'm joined by Dr. Angelique Coetzee, who is also the chairperson of the South African Medical Association. And she was at forefront of what today we know as Omicron. And she had her own views on it, which ultimately proved to be correct globally. And today, she has made time to be with us when India is battling an Omicron-led third surge. Thank you so much again. And my first question to you is, what was South African experience, the South African experience of Omicron?
Good evening to all your viewers out there. Our experience was exactly the same than your experience right in the beginning. Our numbers doubled as well. And we still encouraged, even though the numbers were high, we keep on encouraging patients, if they have symptoms, to please go and get themselves tested, or take them at least out of the population or out of circulation, so that they do not infect other people. So we had exactly the same picture than yours. Although I'm not sure what your hospital admissions rate are, but our hospital admission rate still stays low right through the fourth wave, and it's not even comparable to Delta.
How many cases were critical, and what was the component of the ventilators or the oxygen beds which were required in South Africa?
It's very low. The numbers, I don't have yesterday's numbers with me, but I've got the day before yesterday. As I've said, very low. If you compare it with what you have seen with the third wave, where we saw Delta. So for the data that was released on the 4th, looks to the data for the 3rd, and people only needing oxygen across 666 hospitals was 1,294, and in ventilators only 309 across 666 facilities in South Africa. And only admitted was 8,857, and that also includes people admitted with other diseases and then discovered that they have test positive for Omicron.
Tell me, why has this impression gained ground that Omicron is like end of the pandemic? It's like a common cold. It's nothing like Delta. So it's all okay, to carry on with the business, your daily routine with Omicron all around. Why has that happened?
So I'm not sure how people look at diseases and infections and what messages are going out to people. But it is important to understand that if you are above a certain age group, especially at 50 years and older, with other diseases like diabetes, like high blood pressure, like severe overweight, and you get Omicron after you've been vaccinated or unvaccinated, you need to go and see a doctor to double check on that, because it might be mild, but there's always still a risk going forward to get what we call pneumonia later on. So it is a mild disease in the terms that, and we have said it many times, it's mild because I can treat you at home. I do not need to admit you. But it doesn't mean that you need to be ignorant and say, yes, it's a mild disease, therefore I don't need to go and see anyone. Especially, again, if you are above a certain age group, certain diseases that you are suffering for, or immune compromised diseases, you have to double check on your health. The young people, they do exceptionally well, and then they are healthy, as a rule. So that's where I think it comes from. So for certain people, yes, it will definitely be a cold. For others, it will be more like a flu. And then for others, it would be a severe flu. But meaning, don't underestimate the viral infection, even though it's mild.
Do you feel that Omicron can actually cripple medical infrastructure in a populous country like India?
It depends. It depends on how many overweight, untreated, unvaccinated patients you have with diabetes, especially diabetes is a huge problem, and hypertension. So if your people are quite well controlled, vaccinated, then there should not be a reason for them to overwhelm the system, even if they get severe disease. What we have seen with the severe disease is a pneumonia, and still the fact that you would need hospitalization would most likely be more to give you support. You can get a bit of oxygen in the hospital, but it's to try to get the infection down, and not so much because you are so severely ill. So if people go to hospitals unnecessarily, yes, you will cripple any system. But therefore, again, you have to give your people the clinical symptoms and empower them when to go and see a doctor and when to be admitted.
Tell me, is Omicron as dangerous as previous coronavirus? What makes it different? What makes it different so that people should take precautions, as you were mentioning?
So it's still part of the corona family. You should never underestimate that. So what makes it different? The difference is that the clinical symptoms are much milder than Delta, and the complications milder than Delta, especially for those that are vaccinated. However, if you are, again, and not vaccinated, you might end up with severe disease. And again, the severe disease would be a type of pneumonia, lung infection that you will get. But Omicron predominantly do not affect the lungs that much than Delta did. Omicron is more upper respiratory, with that slight cough and a bit of a nose and a bit of a sore throat, and then with the body aches and pains that goes with it, and not feeling well.
These are the symptoms you have spoken about, but in terms of a larger policy, in your opinion, what should be the way forward for India?
There's two ways that you look at this. And the one, you can never vaccinate someone out of a pandemic. So we need to be honest around that. We need to make also sure that patients understand, or people understand, what is the value of the vaccines and why do you need to get vaccinated. Then the most important part is the common sense part, where you have to wear your masks. You should be, it should be compulsory to wear masks if you go out of your home, wherever you go and meet with other people. It should be compulsory. Should look at your ventilation. And in years like South Africa, you should make sure that they are running water for people to wash hands, wash their masks, and then stay away from crowds. Big groups of people, stay away. That's the common sense simplicity of I nearly want to say is one of the best treatments that you can do, and then get your people vaccinated. But you have to take them on the journey. They need to understand what's the value of the vaccines.
My question is that the new variants, do you feel, are a result of vaccine apartheid because vaccines are not available in poor countries?
Oh, yes, now I've got you. Yes, no one would sleep safe at night if Africa has not been vaccinated. But now we've got another problem with the vaccines in Africa, and that is the logistics around these vaccines. These vaccines are more applicable to first world countries where there are shorter distances. There's nice fridges. It's easy to, people are better trained. The infrastructure is just much better. In Africa, very, very difficult to use these vaccines with these temperatures and long distances. The logistics around them are just very, very complicated. And I've said this before, and I think the prudent thing going forward would be for companies to start making a tablet, which is much easier and would give you better access in the poorer countries towards vaccines if it's in tablet form. So even though you can dump a lot of vaccines that's nearly expiry date in Africa it's still not really going to help Africa because the infrastructure to get it to the people or to get the people to the vaccines, that's a huge problem. So yeah, but if Africa is not vaccinated, you can boost it as much as you will, but we will always see variants coming.
Do you feel that Omicron variant can again mutate and change character? Is it a possibility, madam?
Yeah, I really think so. And again, remember the vaccines, the variant wants to survive. The question is how it will change. Will it change to be just as fast spreading, or will it change to be slow spreading but more virulent? Only time will tell us. And I think eventually this will become endemic. And again, that's why it's so important for people to learn how to live with the virus. And your masks and that simple measurements, that's actually your gold standard going forward.
Are you saying that this pandemic, epidemic, or this problem of the COVID-19 family is not going to go away very soon?
I don't think it's going to go over very soon. The moment when you start to lower your guard, don't wear masks, goes to big big gatherings, you might be surprised to find that at it again and start the whole process again. So the mask wearing actually prevent you from spreading the virus. So if we can prevent the spreading of the virus, then it's difficult for the virus to survive.
But isn't it? This is so depressing to come from such a practitioner like you to say that this virus is not going to go anywhere. Are you saying that humanity should now learn to live and coexist with COVID-19 family of viruses?
I think for the next 2 or 3 years we will have to live with it. The moment when you start to lower your guard, it means behavior. I mean, it's all about behavior, behavior. People then behave in their old ways, and this is, unfortunately, we are people who loves to socialize, to be in close contact, to go out, children love to go to parties. And you'll need, you just have to learn how to do it. So you can go out, but make sure the ventilation are good. Out in the open, much better. Just wear your mask. It's not that difficult if you really start looking in it. We are so used now in South Africa to wear our masks. Since the pandemic started, we were told that we have to wear our masks. And for now, there's no curfews anymore in South Africa. There's no restriction of movement in South Africa, but the masks are still there. And I think if one can learn how to work around it, you should be fine going forward, especially if you take your vaccines. But we cannot booster everyone every 3 months if there's a new variant. That we cannot do it.
So are you saying that this whole policy of boosters is ineffective in long run? You can't have a 4th booster, 5th booster, 6th booster. That's not feasible.
Well, it's feasible. You can have it. But how long do you think the average public out there is going to stand for that? So from a scientific and academic point of view, yes, it's feasible and you should do it if you look at the science. But what is the average person out there? How long do you think are you going to tell the population, now you need to go for another booster? How long do you think that would be, the people will take the journey with you to get all these boosters? Do you think, can you see yourself for the next 3-4 months, every 3-4 months getting a booster?
So basically saying that the only deterrence to this is masks and hygiene issues.
Very, very important. Mask and hygiene, and you have to get vaccinated. But what I'm trying to say is, we have now seen that some of these vaccines, after 3-4 months, we need boosters. So that means, if let's say that is the case going forward, it means that 3 times a year you're going to get a booster. It is already difficult to get the average person out there just to get his first jab. So how long do you think people are going to go for boosters before they just say, no, man, you know what, I'd rather take my chances? That's you again, human behavior. So we need to look at all of that. We need to understand that at some stage people are going to say, I've not been vaccinated enough. You know what?
But doctor, tell me one thing. I know this is not part of your subject. Tell me this. Then how does democracy survive COVID-19? People can survive COVID-19. States can survive COVID-19. Then how do democracies survive COVID-19? You can't have rallies. You can't meet people. You can't come and form associations. And how does this form of governance will survive this pandemic?
You will survive, because you will have to learn how to live with it. So you can go and meet people. Just make sure that you are outdoors, especially in summer months. If it's indoors, open the windows. If you don't know the people that you are sitting with, wear your mask. That's the best protection that you actually can give the other people around you, because remember, you wear your mask not to spread the virus. So you don't know when you have an underlying. And remember that what we also said is that 2 days before symptoms, 2 to 3 days before symptoms, within any viral infection, up until 2 days after symptoms, you are highly contagious. So you never know. That's why you need to wear the mask. You never know when you have something underlying, because you will feel fine. But if you already have a viral infection that you can spread and you're not wearing your mask, you will spread it. So it's the basic things that we need to do. We need to make sure that the schools got good ventilation, that there's running water in the schools. So if you get good running water and sanitation, a lot of your other diseases will also get better. We have seen in South Africa, especially in 2020, when we had that severe strict lockdown, that we never even see colds and flus from the patients, because everyone was too scared to go out of their homes. And if they did, they wear their mask. So our infection rate for other viral infections also came down. And I think the same will happen in your country. But masks, very important. I'll still stay to that.
So you're saying that the mask, sanitation issues, being careful is the key to combating the virus. Thank you, Dr. Angelique Coetzee, so much for making time for the special edition of Newsline. You're the person who was at the forefront of this Omicron variant in deciphering it in context of public medicine, social medicine. When it came to your country, and now the world is battling with it, and the advice you have for the other country people is, you just got to wear your mask. Thank you so much. Thank you.
Thank you so much. Thank you.